Valerie Harper is scheduled to share more about her experience with cancer tomorrow on the Today Show and tomorrow night in an hour-long special hosted by Meredith. And you can watch here on 41 NBC at 10 p.m. Now, to talk more about Valerie Harper's story, we have Coliseum Health Oncology Nurse Navigator Beverly Stanley here with us this morning. Welcome to 41 Today.
Thank you. Good to be here.
Okay, Beverly, Valerie's story, we just watched it. That's pretty incredible.
Very.
How common is that for someone who is, diagnosed with something terminal?
It's not real common. It's getting more common now because we're getting much more targeted drugs. We're finding out more through research so that we can go and do things. But once you have an incurable terminal disease, it's like a chronic disease. You've always got it. It's not going to go away, but we can certainly treat it, do maintenance drugs, and help you to have a good quality of life. But, you know, if something else, if you don't have cardiac disease or something else that causes your death, prior to that, then it's probably going to be the cancer that's going to do it. But she's got a great outlook. She's doing everything she can. And I love it. Looking at this is so touching because it's so much that I see every day with my cancer survivors. Cancer is a great equalizer. You know, whether you're a television personality, a movie star, or just the girl next door.
Right. Now, I've noticed she hasn't really shied away from the cameras since her diagnosis. I think even she signed up to do Dancing with the Stars. I mean, is this okay for her to be doing with her condition, with her health the way that it is?
Well, I guarantee you that she's talked thoroughly with her doctor about this. And as long as she's doing well, her blood counts are up, chemotherapy has its side effects, and so as long as she can manage those side effects, then she'll be able to do this. You know, at any time the doctor could say, no, enough's enough, we have some complications or some things going on that I think are putting you at risk, and she could have to stop. But the goal is get out there and try. If you don't get out there and try, you're never going to know.
Now, you mentioned her positive attitude, and we clearly saw that in that story. Does a positive attitude necessarily mean that it's going to prolong your life with a diagnosis like this? No,
we can't say that it does. I mean, because, you know, can't somebody that succumb to it because they had a poor attitude, never. But it helps. It makes the daily grind, dealing with it on a daily basis, better. Most people that I talked to and have dealt with through the years said they would have never chosen a cancer diagnosis, but they got lots of positives from it. They met people they would have never met, did things they would never be able to do. They work with advocacy. They go and talk to other cancer survivors about their story to kind of provide encouragement. And so it's not anything you choose to have, but you can find the positives in any experience.
And really quickly, we have a couple seconds left. You know, you see patients like this every day. What do they tell you that they do that really helps them?
Well, a lot of them say their faith. They have a strong faith. A great family support, or friends support to get you through this is just incredible. I see very few patients that don't have a good support system, but those that do have a little harder struggle.
All right. Well, thank you so much for being on the show.
Well, you're so welcome.
We really appreciate it. Now, for more information on the topic of cancer, you can head to coliseumhealthsystem.com or, of course, visit the American Cancer Society at cancer.org.